Hi, my name is Akhil Sood. I'm reporting for Room Now from Galveston, Texas. Today, I have the pleasure of speaking with Dr. Elena Myasoedova from the Mayo Clinic. Dr. Myasoedova is a rheumatologist who has done extensive work on rheumatoid arthritis and aging. And today, I had the pleasure of learning from Dr. Myasoedova at the expert panel on the 5 M's of aging. And today, I want to focus on one of the M's, mentation. And Dr. Myasoedova has two abstracts presented at ACR focusing on mentation. Abstract 284, which is the risk factors for dementia in patients with rheumatoid arthritis, a population-based cohort study. And the second abstract is 1646, which is abnormalities in cerebral vascular biomarkers in patients with rheumatoid arthritis, results from a prospective study of cognitive aging. Thank you, Dr. Myasoedova.
Thank you for inviting me. I can walk you through these abstracts.
We'd love to talk about both your abstracts. I guess the first one will be abstract 284. Would you be able to discuss some of the key findings from that abstract?
Absolutely. So that abstract was a retrospective cohort study of patients with rheumatoid arthritis. It was done among the Olmsted County, Minnesota population using the Register Epidemiology Project resources. We were looking at predictors of dementia in patients with rheumatoid arthritis. We had a cohort of slightly over 1,300 patients, and were able to identify a few risk factors for dementia of all-cause dementia, including age, which was not surprising, but also cardiovascular disease, specifically stroke and heart failure, and also we found that severity of rheumatoid arthritis, including swelling of large joints, also played a role, negative role in risk of dementia onset in these patients. So these were the major findings, and it does appear curious that among the risk factors, cardiovascular disease emerged along with severe rheumatoid arthritis.
Yeah, and that's very interesting, is seeing the risk factors of the joint swelling as well as the cardiovascular risk factors in stroke associated with the increased risk for cognitive impairment. I was curious, did you look at the duration of disease and see if that could be a mediator for these risk factors as well as the joint swelling in association with cognitive impairment?
So in our other study, actually, that the one that I will be discussing, we did look at RA duration, and that came up as one of the factors associated with cerebrovascular abnormalities, actually by imaging. In this study, RA duration by itself was not a significant predictor for some reason, and that potentially could be because the duration was about 9 years on average, and then we started in mid-50s, so perhaps this cohort is a little younger.
That's very interesting. And then what are the future directions for the study?
It's interesting whether the association between inflammation or rheumatoid arthritis rather and dementia is due to inflammation per se, and how much also cerebrovascular and cardiovascular risk factors and conditions affect this association. So is there an interaction or some sort of other interplay, whether or not composition of this umbrella of dementia outcomes, including dementia subtypes like vascular dementia, different in patients with rheumatoid arthritis as opposed to the general population? Is the increased risk of dementia due to increased risk of vascular changes or neurodegenerative changes leading to Alzheimer's disease, for example?
Absolutely, that's really interesting. And even one thing too I saw was the DMARDs as well, in the impact of DMARDs in cognitive function. The majority of the participants in the study were on TNF inhibitors, is that correct?
Yes, correct. So the TNF inhibitor was the predominant class of medications, and especially because the patients were enrolled in early years when TNFs were, in general, predominant class of biologics. So that explains it. We do plan, as part of the studies that are supported by my R1 grant, to address the impact of systemic inflammatory burden, essentially evaluating the cumulative inflammation over the course of RA duration to the outcome of dementia, and also looking at the use of medications and trying to see if they play a role, perhaps in prevention or of onset or progression of dementia.
Wow, that's very interesting. Yeah, that's really great to hear. And you touched a little bit upon your other abstract as well, abstract 1646. Could you highlight some of the key findings from that abstract?
Yeah, so that abstract was different from methodology standpoint. That study enrolled patients from a Mayo Clinic study of aging cohort. So that is a prospective study that's also done within Olmsted County residents, but it's done prospectively with very comprehensive evaluation of cognitive status, as well as brain imaging, identifying neuroimaging biomarkers of cognitive, suggestive of neurodegenerative disease or vascular changes in patients in general population, and in particular in patients with rheumatoid arthritis. So among that cohort, which is about 6,000 patients large, we identified patients with rheumatoid arthritis who had neuroimaging studies and matched them to general population comparators, and just compared how they the prevalence of cognitive impairment, dementia, comorbidities, as well as neuroimaging biomarkers in these two groups. So in patients with rheumatoid arthritis, despite similar comorbidity profile and similar clinically similar cognitive status, similar prevalence of cognitively unimpaired patients with cognitive impairment, which was about 20%, and a small number of patients with dementia. And we found that patients with rheumatoid arthritis actually were more likely to have this higher white matter hyperintensity volume, which is a proxy to cerebrovascular abnormalities, and was completely subclinical without any other associated findings, with no difference in prior strokes or heart failure or other comorbidities. So that was quite a curious finding, and potentially can give us maybe tools to screen for early markers of predictive of cognitive impairment in the future, because these white matter hyperintensities have been associated in other studies with onset of cognitive decline and dementia.
Absolutely, that's very interesting. And so we're able to find if these imaging findings correlated strongly with cognitive impairment or dementia, or is that too early to say at this time?
So we can't say based on this study because they didn't differ in these outcomes clinically. They were similar in prevalence of these outcomes between the groups. But for the future studies, we did outline identifying, first of all, the role of systemic inflammation in these cerebrovascular changes, and then associating these changes to cognitive impairment and dementia in patients with rheumatoid arthritis, and certainly understanding whether DMARDs and biologics may play a role in preventing these neuroimaging changes from occurrence, or preventing progression from these neuroimaging changes to clinically evident cognitive decline.
Absolutely, and that was my next question too. Is just what are the future directions? And you answered that is that, looking at, especially it would be really interesting to see how DMARDs affect the impact on cognitive function, how this correlates with the imaging, and even from your previous abstract as well. And that's really interesting and very remarkable.
Yeah, dementia is an incurable disease so far, and so just thinking along the lines of inflammation and its potential impact, and trying to see if this can be a potential target for treatment in patients with rheumatologic conditions, specifically in rheumatoid arthritis, but also that can be to an extent then extrapolated to other chronic inflammatory conditions, and to some part to the general population, because the burden of inflammation is increasing with aging. So the implications of these studies are expected to be broad.
Absolutely, and that's very interesting. Yeah, thank you so much, and really appreciate it. Really enjoyed hearing about both of your abstracts and really remarkable work that you've done on aging and rheumatoid arthritis. And as you said too, is the broader implications as well within the field of rheumatology. It's very exciting, and I'm really happy to interview with you.
Thank you so much for the opportunity.
Thank you.